today we're going to be going over the dynamic gait index. It's an 8-item scale, max of 24 points. Higher scores are better. It is used to assess one's risk for falling when going around the community. It's been highly recommended for those with Parkinson's, those who have experienced a stroke, and with vestibular conditions, and it's recommended to use for those with multiple sclerosis. So a score of less than 19 out of 24 indicates a fall risk. For the setup, you need a 6-meter track or 20 feet. Then you will need to make sure you know that there are 5 feet points. You will need a gait belt around your patient. And then if they use an assistive device, it's okay for them to use it, but you just have to note it when you document. You will also need cones for obstacles to step around, and then a shoebox or something that's 4.5 inches. So we'll first start. Hi, Skylar. Today we're going to be conducting the dynamic gait index. I just want to see how well you're able to walk in different conditions around town and in your home. Is that okay?
Yep.
All right. We will first start with the first item, which is, Skylar, I'm going to be right by you. I want you to walk from this end of the tape to the other end. You can go ahead and walk whenever you're ready. Stay in between the sidelines. It's important to not walk in front of the patient or to the side, as you don't want to pace them. And while this is happening, I was looking for any deviation outside of the 15-inch width or any instability. Next, we'll be assessing changes in gait speed. So we'll go back to the other end. Don't need to assess this part, we just need 5 feet. So, Skylar, what I want you to do is, when I say, you'll just walk at a normal pace. When I say go, you'll walk as quickly as possible. And then when I say go again, or when I say slow, you'll walk as slowly as possible, okay? So, start walking. At 5 feet, go, and then slow. Every 5 feet, and I'm assessing, can she do it quickly? Is she unstable? Does she deviate outside of the 15 inches? The next step will be, we can stay here actually. We're now going to be assessing how she maintains her balance during horizontal head turns. So, Skylar, what I want you to do is when I say right, you will keep walking straight, but you'll turn your head right. When I say left, you will turn your head left and keep walking straight. Okay?
Okay.
All right. Right, left, right, left. Good. You want to go through 2 rotations of turning left and right, and again, looking for changes in gait speed, if she wobbles, if she steps out of the 15 inches. The next is vertical. So this time, Skylar, when we're walking, when I say up, keep walking straight and look up. When I say down, look down. Okay?
Okay.
All right, go ahead. Up, down, up, down. Good. Next will be the pivot. See how well she can turn. And this one is a time-based one. I want to see how long it takes you to do it and how steady she is when she does it. Skylar, when we walk, I'm going to tell you to turn around at a certain point, and all I want you to do is turn. Okay?
And keep walking backwards?
No, you just turn. Yep. All right, go ahead. And turn around. Good. Less than 3 seconds is a normal response. It goes on from there in scoring. And each item is scored on a scale of 0 to 3 points. The next item is going to be stepping over an obstacle. So, you can use a box or a shoebox, something around 4.5 inches. It can be placed anywhere on the track, but since our other items that we're going to have to step around are around 6 feet, I will just put this around 6 feet away. All right, Skylar, what I want you to do is walk to the other end of the tape and step over the box. Good. And I'm looking to see if she has to, if she stutters, if she hits the box, any imbalances like that. The next will then be around objects. We'll go back to this end. For this, you'll have two objects. They will both be around 5 feet away from each other. So 5 feet from the start, and then the second one is 5 feet away from the first cone. So Skylar, what I want you to do, when you get to the cone, step around the cone and step around the other, okay?
Okay.
Go ahead. Good. And again, looking for any disabilities or faltering, anything like that. Then the last thing is steps. So there isn't a set amount of stairs you need to use for this test. So we'll be using this staircase. I'm looking for if she can do it without any assistive devices or having to use the railings. Skylar, what I want you to do, walk up. At the top, turn around, walk back down. Okay? Go ahead. Good. And you're just looking to see instability, faltering, having used the railing. Those are the items to the dynamic gait index. Thank you for watching.
So for the functional gait assessment, or the FGA, what we're looking for is we're trying to decrease the ceiling effect and improve reliability when we're comparing that to the DGI. The goal of this test is to help see ambulatory gait and fall risk with patients with vestibular disease, patients with Parkinson, or older adults. The score frame, the highest possible score you can get is a 30. If you're below or equal to 22, you have high risk of falls, and if you're less than or equal to 20, you have higher risk of falls in the next 6 months. With this test, you need a timer to time certain aspects of the test. You need to mark out 20 feet or 6 meters for the walkway that the patient's going to use. You need shoe boxes or some type of box that is 4.5 inches high. You need a set of steps. It does not specify the amount of steps you need, just you need some type of steps. The patient can use an assistive device. It just will affect some of the scoring criteria later on, and the use of any type of normal everyday shoe is allowed.
For the functional gait assessment, the first task is going to be walking 20 feet on a level surface. We have 12 inches that he needs to stay in between. We're going to be doing this based on time and whether or not he deviates from the 12 inches. So whenever you are ready, you can go. All right, for the second task, I'm going to have him start walking. Again, we're going to go 20 feet, but after the first 5 feet, I'm going to say go, and you're going to walk faster. And then after another 5 feet, I'm going to say slow, and you're going to slow down for the remainder of the 20 feet. Okay, so whenever you're ready. Go, slow. Good. All right, for the third aspect, is going to be horizontal head turn. So again, you're going to walk from the beginning to about 20 feet. Every 3 steps, you're going to turn your head to one direction, and then 3 more steps, you're going to turn your head to the other direction. We're going to go until you get about 2 turns in each direction. Questions?
No.
Okay. Ready? Good. The step number 4 is going to be turning your head vertically up and down. So when we say, or whenever you start, you're going to take about 3 steps and look up, and then 3 more steps, look down. Again, from here, about 20 feet. Try to get in 2 up and 2 down. Okay. The 5th aspect of this test is going to be a stop and pivot. So I'm going to say, again, walk at your normal pace. At some point between here and that 20 feet, I'm going to say stop and pivot. When I say that, I'm going to start a stopwatch and see how long it takes you to turn and stop facing back this direction. Okay? Good. Whenever you're ready. Stop. The sixth aspect of this test is going to be stepping over something during gait. If they can go over 2 boxes, they can get a 3. If they cannot step over 2 of the boxes, it is a 2 or less, depending on the other criteria. So I'm going to have you, whenever you're ready, we're going to start walking and step over the box, and just stay at a normal speed the whole time. Okay. Whenever you're ready. All right, the 7th aspect of this test is going to be a narrow base of support. So I'm going to have him cross his arms across his chest and take steps forward, heel toe tandem the whole way. We're going to go up to 10 steps. Good. The 8th aspect of this test is going to be ambulating with your eyes closed. So you're going to be, whenever you're ready, we're going to walk from here to that 20 feet with your eyes closed. The 9th aspect of this test is going to be walking backwards. So I'm going to have you turn, face the wall. Whenever you're ready, we're going to go at your own pace, walking backwards the 20 feet, and I will let you know when to stop. Stop. The 10th and final step of the functional gait assessment is going to be looking at steps. So I'm going to have you, whenever you're ready, we're going to step up the stairs at your own pace, turn, and then step back down the stairs.
The DGI and the FGA are very similar tests. However, once you get past step 6 for the DGI, step 7 is maneuvering around obstacles, whereas with the FGA, you have the tandem walking, gait with eyes closed, and ambulation backwards, which kind of differentiates the 2 tests.